Hi, I'm Dr. Siddiqui. I'm the primary physician here at the Vein Place. I want to tell you a little about myself today if I can. I'm a fellowship trained radiologist and started to get involved with vascular work in Orange County. So I've been doing vascular work for the past 15 years here and started to get involved with venous care or with venous ablation over the course of the last 5 years. I realized that there were a number of patients that were undiagnosed and that were going through their life living with pain. Venous disease is often a progressive problem where you start to have reflux, start to have some pain or discomfort in your legs, and you kind of think this is just what's happening and this is par for the course. Actually, this is something that's treatable. Some of the most common symptoms that you might find with vein disease would include aching or heaviness in the legs, swelling. People oftentimes have varicose veins or little spider veins. Some people will get an itchy sensation in their legs, restless leg syndrome, or perhaps even some discoloration, and that's a more advanced process, the disease process. When you come into our vein office here, what we're going to do is to do a complete educational process. So my goal is to help educate you about the disease process. Once you understand what's going on, we can talk about different types of treatment options and what works best for you. Oftentimes, conservative therapy is the first line, and that works well for some patients. And if that's what we're going to do, then we can provide that option for you. If you need to have a more advanced procedure, we offer things along the lines of laser ablation. We do sclerotherapy. We also use omothermolysis to help take care of the veins that are present in the legs. So vein disease is oftentimes hereditary. People who have either a mother or a father with vein disease may have up to a 50% chance of developing some degree of vein disease themselves. Some of the other common causes for developing vein disease would be prior trauma to the legs, a history of prior deep venous thrombosis. Sometimes having multiple pregnancies can be one of the big causative factors. And of course, if you have a slightly larger tummy pushing upon the inferior vena cava or the larger vein that returns blood back up to the heart can sometimes cause the veins to dilate. The etiology of vein disease is something that we'll get into when you come visit us here at the vein office. In short, veins are the structures that return blood back up to the heart. The veins have little valves inside that help control the blood flow in one direction. Once we start to increase the pressure inside of the veins will start to dilate. As those veins start to dilate, the valves become a little bit weaker, and then the valves will actually stop functioning such that the blood flows in the positive direction and then it'll reflux back again. So one process is called venous hypertension, where the pressure inside the vein starts to increase. One disease is called venous reflux, where the blood starts to flow in the wrong direction. Either one of those is diagnosable by ultrasound, which we'll take care of here at the office for you. And then once we find out what the cause is, we can find out the correct treatment process or the correct treatment path for you to follow. Oftentimes, patients will have a medical disease process, which is covered by insurance. Sometimes they'll have cosmetic requirements, and we can definitely take care of all your needs here at the Vein Place. Please don't hesitate to give us a call. We'll be happy to answer any of your questions for you. Some of the benefits that we can provide by having you come by the Vein Place is a free screening. And what I like about the free screening is, again, this is mostly about education for you to try and help you understand the disease process. When you come in, we'll do a screening ultrasound to look and see if we have any vein reflux or any venous hypertension. We'll do a physical examination. We'll evaluate and look at your legs to see if there's any venous disease that's manifesting itself on the legs themselves. Once we've identified the disease processes, we'll talk about all the different options that are available to you for vein treatment. And then once you have a full understanding of what the disease process is, then we can further talk about what the treatment outcomes or the options will be for you. I want to tell you an anecdotal story about a patient that recently came in to have their vein treatment done. This was a young lady, mother of two, who after having her second child realized that she started to get spider veins in her legs. And because the spider veins in her legs, she chose to not wear shorts anymore. Living in Southern California, it can get somewhat warm. So for the course of about 2 years, she kept protecting and hiding her legs by wearing pants and by wearing long skirts. And when she finally came in to see us, we realized that it was a simple cosmetic procedure. We spent two treatments for her here at the vein clinic. We spent 15 minutes at a time. After her second treatment, she received about a 95% improvement in the way that her legs felt. She was absolutely elated by the end result, and was able to wear shorts and be happy again. Another patient I'd like to share with you would be a gentleman that came in. This is a person who had vein disease for quite some time and hadn't really taken care of the vein disease, and developed these large ropey veins that you can sometimes see. Ropey veins is a end manifestation of vein disease where the reflux has gotten to the point where the veins are starting to dilate now, and you can see bulging veins coming through the skin, and that's called varicose veins. So this patient came in, we identified the problem this patient had. This was more of a medical type of issue where he needed to have ablation of the greater saphenous vein. Ablation is a process where we use a laser to provide heat energy, and we denature the protein in the blood vessel. Denaturing makes the blood vessel a little bit sticky. We then provide compression stockings on top. The compression stockings help the two ends of the blood vessel come together, and as that blood vessel is healing, it'll actually fuse together. And once it fuses together, that vein no longer carries blood, and we no longer have the symptoms that can be associated with venous reflux. The blood then transfers to a different vein, which is the healthy vein called the deep venous system, and the blood will return back up to the heart. This patient that had the vein ablation done, once the vessel was ablated, he was free of having a heaviness in his legs. His legs were no longer achy at the end of the day, and when he would go to bed, sometimes he'd feel something called restless leg syndrome, where he just couldn't get happy or just couldn't get comfortable for probably about 2 to 3 hours before he was able to finally fall asleep. And then that again is a common manifestation of vein disease, because the swelling in the legs stretches the nerves that are around the veins, and that causes us to have an uncomfortable or an achy feeling. Patient was treated. Patient was very happy with the end results, and then over the course of the next 2 treatments, we were able to take care of the large ropey veins as well. We did a procedure called sclerotherapy, and then an additional procedure called microphlebectomy, where we initially used polydocanol to chemically treat the veins, and then some of the larger veins that were there, we decided that it would be in his best interest to actually remove those veins. So we used a microphlebectomy procedure to take the little tiny veins that were left over, because once they're treated, they become smaller and smaller in size. We took those veins out. He's now very happy, is able to stand for the entire length of the day without a complication, is able to play with his children without having aching, swelling legs, is able to sleep comfortably and get a good night's sleep for the first time in about 10 years. So again, a very happy patient. We'd love to take care of you. If you do have any questions, please don't hesitate to call us here at the Vein Place.